fluorescent lights hum above white tile floors. The metallic scrape of supply cart wheels echoes down the corridor, mixing with the faint antiseptic burn that clings to every surface. It's 6:47 in the morning, and the hospital is waking up in shifts. Nurses trading reports, residents clutching coffee like lifelines, the occasional patient call button chiming somewhere distant. Claire Reeves moves along the hallway in plain navy scrubs. No badge, no name tag. Just a volunteer lanyard with a faded barcode hanging around her neck. She pushes a linen cart, her dark hair pulled back tight, her movements efficient and unremarkable. Nobody looks at her. Invisible is safer. She passes 2 residents laughing near the nurses' station. One of them, Dr. Kevin Harding, confident and fresh out of med school, glances at her cart and frowns. "Hey, volunteer, we're short on gowns in trauma 2. Can you grab some?" "No, please." No eye contact. Claire nods once and turns the cart around without a word. As she walks past the trauma day, she glances inside through the window. A patient on the gurney, male, mid-50s, pale, sweating. The oxygen mask fogging unevenly. The monitor reads HR 118, BP 142/95, SpO2 91%. Claire slows. The attending physician, Dr. Naomi Glass, late 40s, sharp but tired, is reviewing labs on a tablet near the foot of the bed. "Probable panic attack, Dr. Glass." Glass says to a nurse, "Let's give him 2 milligrams of Ativan and monitor vitals." Claire's eyes flick to the patient's neck. The jugular vein on the right side is distended. Subtle, but there. His breathing is shallow, uneven. The intercostal muscles are retracting slightly on one side. She stops the cart. Her hand twitches toward the door handle. Pneumothorax, right side. He's going to collapse in less than an hour. Her fingers hover over the handle. "If I go in there, they'll ask questions. Questions I can't answer." She pulls her hand back, turns the cart, walks away. 2 hours later, she's restocking gloves in a supply closet near the ER when the overhead page crackles to life. Code blue, trauma 2. Code blue, trauma 2. Her hands freeze on the box of nitrile gloves. Her breath catches. She walks quickly to the hallway, not running, just fast enough. Through the window, she sees Dr. Glass doing compressions on the same patient from earlier. The monitor is flat, asystole. You knew, and you did nothing. She turns and walks away before anyone notices her standing there. But her hands are shaking now, and she grips the edge of the supply cart to steady them. At 8:15, Claire sits alone in the break room at a small table, sipping black coffee from a paper cup. 2 nurses enter, laughing. "Did you see the new volunteer?" Nurse Jenna says, perky and loud. "She's been here 3 months and still hasn't said more than 5 words. Nurse Amy, older and drier, snorts. "Probably failed out of nursing school." Jenna giggles. "Or she's one of those wellness journey types. You know, escaped a corporate job, wants to give back." They don't notice Claire 2 tables over. Or maybe they do. Claire's hand tightens around the cup. The cheap Eep ceramic. The heat against her palm. Her eyes drop to her left wrist. A thin braided paracord bracelet, faded green and black, worn almost threadbare. Let them think what they want. She finishes her coffee and stands. The nurses don't look up. By late afternoon, Claire is in the basement storage area, restocking IV kits on metal shelves. The fluorescent light flickers overhead. The air smells like cardboard and disinfectant. She reaches for a box on the top shelf. Her fingers brush cold metal, a fire extinguisher bracket, the texture, the temperature. Her breath catches. Darkness, the hum of an engine. Sand in the air. "Phoenix, we're 2 minutes out. You good?" A younger version of herself, Captain Claire Reeves, nods, her face half lit by a green chem light. She's in full combat medic gear, hands gloved, trauma shears clipped to her vest. "Good." The Humvee jerks to a stop, shouting. Dust, the sharp crack of distant gunfire. Claire's hand is still on the shelf. Her pulse is loud in her ears. She closes her eyes, breathes. Not here, not now. She lowers her hand and finishes stocking the shelf. Footsteps behind her. "You always work this late?" Lucas Tran, hospital security guard, mid-40s, leans against the doorway. Claire doesn't turn around. "Couldn't sleep." "Yeah, I get that." A pause. "You move different, you know." Claire's shoulders tense slightly. "Different how?" Like someone who's used to carrying more than a linen cart. She turns to face him. Her eyes are calm, unreadable. "I used to work freight, warehouse stuff." Lucas nods slowly. Sure. He doesn't believe her, but he doesn't push. After he leaves, Claire sits on a supply crate and pulls a small battered notebook from her scrub pocket. The cover is worn. No title. She opens it. Inside, a list of names. Handwritten. Faded ink. SGT, Rios, CPL, Davies, PFC, Nguyen. LT. Kara Sullivan. 12 names total. She doesn't read them. She just holds the page open. Then she closes it, puts it back in her pocket. You're still here. They're not. That's the deal. She stands and walks back upstairs into the light. The fluorescent light flickers in the storage hallway. It's 11:20 at night. Claire is alone, restocking IV kits on a metal shelf. The clink of plastic, the rustle of sterile wrap. Her hands move efficiently, no wasted motion. She reaches for a box on the top shelf. Her fingers brush cold metal, a fire extinguisher bracket. The texture, the temperature. Her breath catches. Darkness. The hum of an engine. Sand in the air. A voice, male and calm. Phoenix, we're 2 minutes out. You good? A younger Claire, Captain Claire Reeves, nods. Her face half lit by a green chem light. Full combat medic gear. Hands gloved. Trauma shears clipped to her vest. Good. The Humvee jerks to a stop, shouting, dust. The sharp crack of distant gunfire. Someone screaming for a medic. Blood on her hands before she even opens the door. Claire's hand is still on the shelf. Her pulse is loud in her ears. She closes her eyes, breathes. Not here, not now. She lowers her hand and finishes stocking the shelf. Footsteps behind her. You always work? Work this late? Lucas Tran, hospital security guard, mid-40s, leans against the doorway with his arms crossed. Claire doesn't turn around. Couldn't sleep. Yeah, I get that. A pause. You move different, you know? Claire's shoulders tense. Different how? Like someone who's used to carrying more than a linen cart. She turns to face him. Her eyes are calm, unreadable. I used to work freight. Warehouse stuff. Lucas nods slowly. Sure. He doesn't believe her, but he doesn't push. After he leaves, Claire sits on a supply crate and pulls a small battered notebook from her scrub pocket. The cover is worn. No title. She opens it. Inside, a list of names. Handwritten. Faded ink. SGT Rios, CPL Davies, PFC, Nguyen LT Kara Sullivan. 12 names total. She doesn't read them. She just holds the page open. Then she closes it. Puts it back in her pocket. You're still here. They're not. That's the deal. The next morning, Claire is back at the linen cart. 6:30. The ER is starting to wake up. She's folding towels near the supply closet when Dr. Harding walks past, talking loudly on his phone. Yeah, I had 3 admits last night. One of them coded, but we got him back. He doesn't look at her. Claire keeps folding. An hour later, she's in the med supply room, counting bandage rolls. Nurse Jenna enters, scanning shelves. Do we have any more 4x4s? Jenna asks, not looking at Claire. Top shelf, left side. Jenna grabs the box without a thank you and leaves. Claire finishes counting, logs the inventory on a clipboard. Her handwriting is neat, precise. Military standard block letters, though she tries to soften them now. She's walking back to the cart when she hears raised voices near Trauma 1. She slows, listens. I don't care what the protocol says. We need to intubate now. Dr. Glass, firm but controlled. His oxygen is holding at 89. We can try BiPAP first. Dr. Harding, defensive. He's tiring out. Look at his accessory muscles. Claire stops near the doorway. She can see through the window. A patient in his 60s, sitting upright, leaning forward. His shoulders rising with every breath. Retractions visible at the clavicles. His skin is pale, lips faintly blue. He's going to crash. Dr. Harding hesitates. I'll set up the BiPAP. Claire's hand tightens on the cart handle. Walk away, not your job. But she doesn't move. Dr. Glass steps closer to the patient, checking his pulse. Sir, we're going to give you some support for your breathing, okay? The man nods weakly. His eyes are glassy, confused. Claire watches the monitor. SpO2 drops to 86, heart rate climbing to 124. She takes one step toward the door, then stops. You can't. Not yet. She forces herself to turn away. At lunch, Claire sits outside on a bench near the ambulance bay. The air is cool. She eats a sandwich she packed from home. Turkey. Plain. Lucas walks over and sits down beside her without asking. You hear about the guy in Trauma 1? Claire looks at him. They had to intubate him. Dr. Harding waited too long. Patient went into respiratory arrest. Claire says nothing. Dr. Glass saved him, though. She's good under pressure. Yeah. Lucas unwraps a protein bar. You ever work in a hospital before this? No. Huh. You seem like you know your way around. Claire takes another bite of her sandwich. I'm a quick learner. Lucas nods. He doesn't push. But he's watching her. That night, Claire is restocking blankets on the second floor when the lights flicker. Once. Twice. Then steady again. She pauses. Looks up at the ceiling. Somewhere deep in her mind, another flicker. Another place. A field hospital. Canvas walls. A single bulb swinging overhead. The generator choking, sputtering, dying. Phoenix, we're losing power. Switch to the backup. Now. It's not turning on. Her hands slick with blood, working by flashlight. A soldier's abdomen open on the table. She can't see the bleeder, but she can feel it, pulsing under her fingers. Someone get me light. Any light. A chem light cracked open. Green glow. Just enough. She clamps the vessel. Ties it off. The bleeding stops. The generator kicks back on. The lights return. Claire blinks. She's standing in the hallway, blankets still in her hands. Her heart is pounding. She sets the blankets down on the shelf and walks to the bathroom. Runs cold water over her hands. Looks at herself in the mirror. Same face, different person. She dries her hands and goes back to work. At the end of her shift, Claire changes out of her scrubs in the volunteer locker room. She pulls on jeans. A plain black jacket. She leaves the hospital through the side exit, the one the staff rarely uses. The air outside is sharp, clean. She walks 3 blocks to the bus stop, sits on the bench, waits. A man in a suit sits down beside her. Mid-50s, tired eyes. Long day, he asks. Yeah. You work at the hospital? Volunteer. He nods. That's good of you. Claire doesn't respond. The bus arrives. She gets on. Finds a seat near the back. Watches the city pass outside the window. You're still running. She closes her eyes. But you can't run forever. It's 2:34 in the morning when the first ambulance screams into the bay. Claire is in the supply hallway, restocking gauze pads. She hears the sirens. Then another. Then a third. All overlapping, wailing into the night. She sets down the box and walks toward the ER entrance. The double doors burst open. Paramedics rushing in with a stretcher. A woman, 20s, covered in blood, neck brace, screaming. Then another stretcher. Then another. Multi-vehicle pileup on Interstate 94, a paramedic shouts. At least 12 critically injured, more coming. The ER explodes into motion. Dr. Glass runs toward Trauma 3, pulling on gloves. Dr. Harding sprints past Claire toward Trauma 1, yelling into his phone. I need 2 more units of ONEG in Trauma 1, now. Nurses scrambling. Residents shouting orders. Monitors beeping in overlapping chaos. Claire stands near the triage desk, holding a clipboard. Officially, she's logging supplies. Unofficially, she's watching everything. Another ambulance. Another stretcher crashes through the doors. Paramedics shouting. Nail, late 20s, ejected from vehicle, GCS 6, tension. Engine pneumothorax right side. We couldn't get a needle decompression. He's crashing. The patient, Danny, construction worker, blood streaked across his face, is gasping. His eyes rolling back. His chest is asymmetrical. The right side bulging unnaturally. The monitor screams. SpO2 drops to 76%. Dr. Harding runs over, hands already shaking. Get me a 14 gauge and prep for chest tube. A nurse hands him the needle. He moves toward the patient's chest, searching for the landmark. Second intercostal space, midclavicular line. His hand hovers. I can't find the landmark. SpO2 drops to 68%. Danny's lips are turning blue. Dr. Glass is still in Trauma 3, elbows deep in a chest tube insertion on another patient. She can't leave. Harding, do it now, a nurse yells. He freezes. Claire drops the clipboard. She walks straight into the trauma bay. Let me. Dr. Harding spins around. What? You're a volunteer. Move. Her voice is ice. He steps back. Claire takes the needle from his hand. She doesn't hesitate. Her fingers palpate the chest wall. Second intercostal space. Midclavicular line, just above the third rib to avoid the neurovascular bundle. She finds it, inserts the needle at a 90-degree angle. Pop. A sharp hiss of air releases from the chest cavity. Danny's right side deflates slightly. His breathing eases. The monitor climbs. SpO2 rises to 81%, then 86, then 91. Claire pulls the needle and tapes it in place temporarily. He'll need a chest tube in the next 10 minutes. She steps back. The room is silent except for the monitors. Everyone is staring at her. Dr. Harding's mouth is open. Nurse Jenna's eyes are wide. Another resident stands frozen near the crash cart. Claire turns and walks out of the trauma bay without another word. Dr. Glass appears in the doorway seconds later, gloves still bloody from her own patient. What just happened? Dr. Harding is still staring at the doorway where Claire disappeared. The volunteer just did a needle decompression. What? She walked in, took the needle, did it perfectly, then walked out. Dr. Glass looks at Nurse Jenna. Who the hell is she? Nurse Jenna shakes her head, speechless. Claire is back in the hallway now, walking toward the supply closet. Her hands are steady. Her face is blank, but her heart is pounding. You weren't supposed to do that, Doctor. Glass catches up with her near the linen cart. Wait. Claire stops but doesn't turn around. Where did you learn that? I used to be a paramedic before this. That wasn't paramedic level work. That was surgical. Claire finally turns. Her face is calm, unreadable. I had good teachers. Dr. Glass steps closer. What's your full name? A pause. Claire Reeves. I'm going to need to see your certifications. I don't have them anymore. Then we'll need to talk to HR in the morning. Claire nods. Understood. She walks away before Dr. Glass can say anything else. Behind her, the ER is still chaos. Stretchers rolling, patients screaming, doctors shouting orders. But Claire is already invisible again. She goes back to the supply closet, picks up the box of gauze pads, finishes restocking the shelves. Her hands don't shake, not this time. By the time the sun starts to rise, the ER has quieted. Most of the critical patients are stabilized. The chaos has settled into exhausted silence. Claire is at the linen cart, folding towels. Lucas walks past and stops. Heard you saved a guy's life tonight. Claire doesn't look up. Someone else would have. That's not what I heard. She keeps folding. Lucas watches her for a moment. Then he leans in slightly. You know they're going to ask questions now, right? I know. You got answers? Claire finally looks at him. Her eyes are tired. I'll figure it out. Lucas nods. Yeah, I bet you will. He walks away. Claire finishes folding the last towel, sets it on the stack. Then she stands there, staring at the cart, waiting. She knows they'll come for her eventually. She just didn't expect it to be him. At 6:15. The elevator doors open at the end of the hallway. A man steps out. Colonel James Widmore, late 50s, army dress uniform, chest full of ribbons. He walks with purpose. His eyes scan the hallway. They land on Claire. He stops. Phoenix. The word cuts through the air like a blade. Claire freezes. The pillowcase falls from her hands. The pillowcase falls from Claire's hands and hits the floor. She doesn't move, doesn't turn around. The hallway is busy. Nurses walking past. A resident pushing a medication cart. Someone laughing near the nurses' station. But all of it fades. All she hears is that word. Phoenix. Colonel James Widmore, late 50s, army dress uniform, walks closer. His boots echo on the tile floor. Captain Claire Reeves, 75th Ranger Regiment. Forward Surgical Team, Helmand Province. Claire's shoulders stiffen. She still doesn't turn around. You have the wrong person. No, I don't. He stops 3 feet behind her. Kandahar. 2016. IED strike en route Whiskey. You stayed on that field for 11 hours and kept 4 men breathing until airlift arrived. Claire's jaw tightens. That wasn't me. You carried a PFC named Gwen, 200 meters under fire because the stretcher broke. Her breath stops. He steps closer. You were declared dead in 2018 after a field hospital collapse in Kabul. Your entire team was lost. A pause. Except you. Claire finally turns around. Her face is pale. Her eyes hard. That woman died in Kabul. And yet here you are. The hallway has gone quiet now. Nurses have stopped moving. Dr. Glass is standing near the nurses' station, frozen. Dr. Harding is staring, mouth open. Nurse Jenna's hand is over her mouth. Everyone is watching. Claire's hands curl into fists at her sides. I'm not who you think I am. Colonel Widmore reaches into his jacket and pulls out a phone. He holds it up. On the screen, a video. Shaky, but clear. Claire in the trauma bay. Her hands on Danny's chest. The needle. The hiss of air. Her face. 15 million views, Widmore says. Someone posted it 6 hours ago. The Pentagon flagged it in 2. Claire stares at the screen. Facial recognition did the rest. He lowers the phone. You were declared KIA in Kabul. Officially, you don't exist. You've been living off the grid for 5 years. Claire's voice is quiet. I was careful. You were, but you also saved a man's life on camera. He slips the phone back into his pocket. You can't hide anymore, Captain. Claire looks around. At the faces watching her. At Dr. Glass, still frozen. At Dr. Harding, whose expression has shifted from shock to something else. Respect, maybe. Or fear. She turns back to Widmore. I'm not a soldier anymore. No, you're a volunteer pushing a linen cart. His voice is calm but firm. Except when someone's dying. Then you're Captain Reeves again. Claire says nothing. Widmore steps forward and places a folder on the linen cart in front of her. I'm not here to drag you back, Captain. I'm here because we need you. I'm done. The Secretary of Homeland Security doesn't think so. He taps the folder. There's a biological event unfolding in Detroit. 32 casualties so far. Unknown pathogen. Hemorrhagic presentation. The CDC is 3 hours out and they don't have anyone with field experience. Claire stares at the folder, but doesn't touch it. Send someone else. There is no one else. He leans in slightly. You're the only combat medic in U.S. history who survived a Marburg outbreak in the field and kept your team alive. Her eyes flicker. That was different. How? I had a team. You were the team. Widmore straightens. Helmand, 2017. Marburg outbreak in a civilian population near the base. You stayed for 72 hours. No sleep. No backup. Just you. Claire's hands tremble. 23 patients. 18 survived. 5 didn't. Her voice cracks. Widmore's expression softens. You saved 18 people in an active outbreak zone with no support. Most medics wouldn't have saved one. I failed 5. No. You're the reason anyone walked out alive. Claire looks down at the folder. Her hands are shaking now. They're calling for Dr. Phoenix, Widmore says quietly. That's not my name anymore. It never stopped being your name. Silence. The hallway is completely still. No one is moving. No one is breathing. Claire closes her eyes. You can't go back. You buried that life. But she opens her eyes and looks at Widmore. How bad is it? Bad. Hemorrhagic fever. Rapid onset. Fatality rate so far is 62%. Claire exhales slowly. What do you need from me? Get on a helicopter. Assess the situation. Advise CDC. You don't have to treat. You don't have to stay. Just tell us what we're dealing with. And if I say no? Widmore holds her gaze. Then more people die. Claire looks past him. At Dr. Glass, who's watching her with something like awe. At Dr. Harding, who looks like he's seeing her for the first time. At Nurse Jenna, still covering her mouth. She looks back at Widmore. I'm not a soldier. No, you're something better. He steps back. A Black Hawk is on the roof in 20 minutes. It's your choice, Captain. He turns and walks toward the elevator. Claire stands alone in the hallway, the linen cart beside her. The folder in her hands. And everyone watching. Dr. Glass steps forward slowly. You don't have to go. Claire doesn't turn around. Yes, I do. Why? Because no one else will. She picks up the folder, opens it. Inside, mission details, maps, casualty reports, a photo of a quarantine zone, and at the bottom, a photo of her old unit patch, 75th Ranger Regiment, sua sponte. Of their own accord. Claire closes the folder. She looks at Dr. Glass. I'm sorry I lied. Dr. Glass shakes her head. You didn't lie. You survived. Claire's eyes are wet, but she doesn't cry. She turns and walks toward the elevator. Dr. Harding steps forward. Wait. She stops. I'm sorry. For everything. For how I treated you. Claire nods once. You didn't know. I should have seen you. She looks at him. No one sees what they're not looking for. Then she steps into the elevator. The doors close, and she's gone. The rooftop helipad. Wind whipping across the concrete. The distant thrum of rotor blades growing louder. Claire stands at the edge of the roof, still in her volunteer scrubs, holding the folder. Behind her, Dr. Glass, Dr. Harding, Nurse Jenna, and a dozen others who followed her up. The sky is gray, dawn breaking over the city. Dr. Glass steps forward. You don't have to do this. Claire doesn't turn around. Yes, I do. You've done enough already. No, I haven't. The Black Hawk appears over the skyline. UH-60, black paint. No markings except a small American flag on the tail. It drops toward the pad, rotors cutting the air into sharp bursts of wind. The crew chief waves from the open door. Colonel Widmore steps out, holding a tactical bag. He walks it over to Claire. Your gear. We kept it. She takes the bag, unzips it slowly. Inside, multi-can ACU jacket with her name tape. Reeves, trauma shears, gloves, a small med pouch, and at the bottom, a blood-stained patch. 75th Ranger Regiment, Sua Sponte. Her hands tremble. I can't wear this. You already are. She stares at the jacket, at the name tape, at the patch she earned in another life. You buried this. You left it behind. But she picks up the jacket, feels the weight of it, and something inside her shifts. She looks up at the Black Hawk, at the crew waiting, at the people behind her. And she realizes she never stopped being Phoenix. She just stopped admitting it. She pulls the jacket on over her scrubs. It fits perfectly, like it was waiting for her. Dr. Harding steps forward. Wait, she stops. I'm sorry. For everything. For how I treated you. She nods once. You didn't know. I should have seen you. No one sees what they're not looking for. She turns toward the helicopter. Nurse Jenna calls out, her voice breaking. Come back, okay? Claire looks over her shoulder. I will. Then she walks toward the Black Hawk. The crew chief reaches down and helps her aboard. She straps into the jump seat. The crew chief hands her a headset. Welcome back, Captain. She doesn't respond. Just stares out the open door at the city falling away below. The Black Hawk lifts off. The hospital shrinks beneath them. The people on the rooftop become dots. Then nothing. Inside the cabin, it's loud. The rotor wash, the engine hum, the crew moving with practiced efficiency. Colonel Widmore sits across from her. ETA 43 minutes. CDC is already on site, but they're overwhelmed. 32 confirmed cases, 4 deaths. More symptomatic patients being identified every hour. Claire's eyes are distant. What's the index case? Male, mid-40s, airport baggage handler. Collapsed at work 2 days ago. Hemorrhagic fever, rapid onset, dead within 18 hours. Exposure history. International flight from Kinshasa 3 days prior. Claire's jaw tightens. Congo. Widmore nods. That's why we need you. She closes her eyes. You said you'd never do this again. But some promises weren't meant to be kept. The Black Hawk banks hard. The city below gives way to highways, then suburbs, then the quarantine zone. She can see it now. White tents, vehicles, people in hazmat suits moving like ants. The Black Hawk descends. They land on a cleared section of parking lot outside a convention center. The rotors slow but don't stop. The crew chief opens the door. Good luck, Captain. Claire steps out. Colonel Widmore follows. The air smells like disinfectant and fear. A woman in a hazmat suit approaches. She pulls back her hood. Dr. Sienna Vargas, 30s, CDC epidemiologist, dark circles under her eyes. You're Phoenix? I'm Reeves. I don't care what name you use. I care if you can stop people from dying. Claire nods. Show me the index case. They walk toward the largest tent. Inside, controlled chaos. Medical personnel in full PPE. Patients on cots. Monitors beeping. The sound of labored breathing. Dr. Vargas leads her to a sectioned-off area. A man in his 40s lies on a cot, sweating, bleeding from his gums. His eyes are half open, unfocused. Patient 0, hemorrhagic fever, rapid onset. Fatality rate so far is 62%. Claire kneels beside him, checks his eyes, his skin, his breathing. She's calm, methodical. How long since first symptoms? 11 hours. Then we have less than 6 before organ failure. She stands. Marburg or Ebola? We don't know yet. PCR results are pending. Then treat it like both. Dr. Vargas frowns. We're already following protocol. Protocol isn't enough. I've seen this before. Where? Claire looks at her. Kabul 2018. Field hospital. Hemorrhagic outbreak in a civilian population. Dr. Vargas's eyes widen. What happened? Claire's voice is quiet. Everyone in my unit died. Silence. Except you. I was the last one standing, so I kept working. She walks toward a whiteboard on the far wall. Picks up a marker. 72 hours. No sleep, no backup. Just me and 23 patients who shouldn't have survived. She starts drawing a transmission map. But they did. Claire pauses. Her hand stops midair. 18 of them. Her voice cracks slightly. The other 5 died because I wasn't fast enough. Dr. Vargas steps closer. You saved 18 people in an active outbreak zone with no support. I failed 5. No, you're the... He reason anyone walked out alive. Claire looks down at her hands, at the scars she's carried for 5 years. I didn't come back to be a hero. Colonel Widmore speaks from the entrance. You came back because you're the only one who can do this. Claire looks up, at the tent full of sick people, at the doctors waiting for answers, at the faces that need her. She turns back to the whiteboard. All right, here's what we do. She starts writing. Fast, precise, isolation protocols, transmission vectors, treatment priorities, resource allocation. Dr. Vargas watches, stunned. You're thinking 3 steps ahead. I have to. That's how you stay alive. Claire finishes the map and turns around. We need to identify every contact in the last 72 hours, quarantine them immediately, start aggressive hydration and supportive care, and we don't wait for PCR, we treat presumptively. Dr. Vargas nods. I'll get the team. She leaves. Claire stands alone in the tent, staring at the whiteboard, at the map she just drew, the same map she drew in Kabul, the same fight, but this time she's ready. The command tent is packed. CDC officials, military personnel, local health department staff. Everyone exhausted, everyone desperate. Claire stands at the front near the whiteboard. She's still wearing the ACU jacket over her scrubs. Her hair is pulled back. Her face is calm, but her eyes are sharp. Dr. Vargas stands beside her. This is Captain Claire Reeves. She's seen this before. A few skeptical looks. One man in the back crosses his arms. Claire doesn't waste time. Kabul, 2018. Field hospital collapse during a hemorrhagic fever outbreak. Marburg variant. 43 patients, 12 staff, no backup, no airlift. She clicks to the next slide. A map of transmission vectors. I was the only medical personnel left standing after the first 24 hours. Silence. 72 hours later, 18 civilians walked out alive. She looks around the room. 5 didn't, and I've spent the last 5 years asking myself what I could have done differently. Her voice is steady, but there's weight behind it. So, I'm not here to fail again. She turns back to the board. Here's what we know. Index case, male, mid-40s, airport baggage handler. Exposure in Kinshasa 3 days before symptom onset. Hemorrhagic presentation, rapid deterioration, death within 18 hours. She circles a cluster of names on the map. Secondary cases, all direct contact, family members, co-workers. 1 ER nurse who treated him before isolation. Dr. Vargas steps forward. We've quarantined all known contacts, but we're seeing symptom onset faster than expected. That's because it's not Marburg. Everyone looks at her. It's a hybrid strain. Faster incubation, higher viral load. I saw something similar in Homeland in 2017. A CDC official in the back speaks up. How do you know? Because Marburg doesn't move this fast in a non-endemic region, and the bleeding pattern is wrong. She points to a photo on the board. Look at the petechiae distribution. It's mucosal-focused, not systemic. That's closer to a filovirus. Virus with RNA recombination. Dr. Vargas stares at her. You're saying this is a mutated strain? I'm saying we need to stop treating it like standard Marburg and start thinking about accelerated transmission. Colonel Widmore steps forward. What do you need? Aggressive isolation. Full PPE for anyone within 10 meters of a symptomatic patient. IV fluids, electrolyte management, and we push experimental antivirals now, not later. The antivirals haven't been approved. They're dying anyway. We try. She turns back to the group. And I need everyone to understand something. This doesn't end with treatment. It ends with containment. If one person breaks quarantine, this spreads citywide in 72 hours. The room is silent. Dr. Vargas nods. We'll implement immediately. As the group disperses, Dr. Vargas pulls Claire aside. You've done this before. Really done this. Claire's face is hard. Yeah. What happened in Kabul? The truth. Claire looks away. Her jaw tightens. We were treating 43 patients when the mortars hit. Her voice is quieter now. A flash. Darkness. The hum of a generator dying. Canvas walls collapsing. Dust. Screaming. Blood on her hands. Phoenix, we're losing power. Switch to the backup. Now. It's not turning on. Her hands slick with blood. Working by chem light. A soldier's abdomen open. She can't see the bleeder, but she can feel it pulsing under her fingers. Someone get me light. Any light. A chem light cracked open, green glow. She clamps the vessel, ties it off. The bleeding stops. But when the dust clears, she's alone. Claire blinks. She's back in the tent. Dr. Vargas is watching her. The building collapsed. My entire team was inside. Her hands curl into fists. I woke up 16 hours later. I was the only one breathing. Dr. Vargas's expression softens. How did you keep going? Because there were still patients alive in the rubble. Her voice cracks. I pulled 18 civilians out, kept them hydrated, managed their symptoms with whatever supplies I could salvage. No power, no backup, just me. She looks up. But 5 of them died while I was treating the others. I had to choose who got fluids first, who got the last dose of antibiotics. Her eyes are wet, but she doesn't cry. I made the wrong choice twice, and 2 people died because of it. Dr. Vargas steps closer. You saved 18 people in conditions no one should survive. I failed 5. No, you made impossible decisions and kept more people alive than anyone else could have. Claire shakes her head. That doesn't make it easier. It's not supposed to. Dr. Vargas places a hand on her shoulder. But you're here now, and you're saving lives again. Claire looks at her. I didn't come back to be a hero. I know. You came back because you can't stop being one. Claire closes her eyes. You can't save everyone, but you try anyway. She opens her eyes. Let's get to work. Over the next 12 hours, Claire moves through the quarantine zone like she never left the field, checking patients, adjusting IVs, coaching CDC staff through procedures they've only read about. She's calm, methodical, unshakable. At one point, a young doctor freezes while trying to insert a central line into a crashing patient. I can't find the vein. Claire steps in without a word, takes the catheter, finds the subclavian vein in seconds, threads the line, secures it. Ultrasound next time. Landmark alone isn't enough in hypovolemic patients. The doctor stares at her. How did you? Practice and necessity. She walks to the next patient. By hour 18, 4 more patients have stabilized. No new deaths. Dr. Vargas finds Claire outside the tent, pulling off gloves. You did it. We did it. No, you did it. Claire looks at her. It's not over yet. But we're winning. Claire nods slowly. Yeah, we are. For the first time in 5 years, she allows herself to believe it. Colonel Widmore approaches. The Secretary of Homeland Security wants to give you a commendation. I don't want it. I know. He hands her a folder. But you earned it. Claire looks down at the folder, doesn't open it. I didn't do this for recognition. I know. You did it because no one else could. He pauses. That's what makes you Phoenix. Claire's hands tighten on the folder. Phoenix died in Kabul. No, she's standing right here. Claire looks up at him. Her eyes are tired, but clear. I'm not that person anymore. You're exactly that person. You just forgot for a while. He steps back. The Black Hawk leaves in an hour. It's your call if you're on it. He walks away. Claire stands alone, holding the folder, staring at the quarantine zone, at the people she just saved, and she realizes something. She never stopped being Phoenix. She just needed a reason to rise again. 72 hours later, the outbreak is contained. 32 initial cases, 4 deaths, 28 survivors. Claire stands outside the quarantine zone, removing her gloves. Her hands are steady, but her eyes are hollow. The sun is setting. The tents are still up, but the chaos has settled into exhausted relief. Dr. Vargas approaches, pulling off her own gloves. You did it. Claire shakes her head. We did it. No, you did it. Dr. Vargas holds out a tablet. The Secretary of Homeland Security wants to meet with you, personally. I don't want a meeting. I know, but you're getting one anyway. Claire looks at the tablet, at the official seal on the screen. I'm not a hero, Sienna. You keep saying that, but everyone here disagrees. Claire turns away. 4 people still died. 28 didn't. That's not enough. Dr. Vargas steps in front of her. It's never going to be enough for you, is it? Claire doesn't answer. You're going to carry those 5 people from Kabul for the rest of your life, and the 4 from here. And every single person you couldn't save. Her voice softens. But that's not what makes you a good doctor. What makes you good is that you show up anyway. Claire's jaw tightens. I didn't come back to be reminded of what I lost. No. You came back because you can't let anyone else lose what you did. Claire looks at her. Says nothing. Dr. Vargas hands her the tablet. Think about it. She walks away. Claire stands alone, staring at the empty quarantine zone. You can't save everyone, but you still try. 1 week later, Claire walks back into the hospital. She's in civilian clothes, jeans, plain jacket, the volunteer lanyard still around her neck. But everything is different. The moment she steps through the doors, people stop. Nurse Jenna sees her first. She freezes, then rushes over. Dr. Reeves. It's just Claire. No, it's not. Jenna's voice cracks. I'm sorry. For what I said. For how I treated you. You didn't know. I should have seen you. Claire's expression softens slightly. No one sees what they're not looking for. Jenna wipes her eyes. Thank you. For everything. Claire nods. Dr. Harding approaches next. He looks different. Humbled. Can I talk to you? They stepped into an empty hallway. I want to learn from you. Claire shakes her head. You don't need me for that. Yes, I do. He pauses. I froze in that trauma bay, and you didn't. We're still learning. That's normal. But you weren't learning. You were surviving. Claire looks at him. There's a difference between medicine in a hospital and medicine in a war zone. You'll learn the first. You'll never need the second. But what if I do? She studies him for a moment. Then you'll do what you have to, like everyone else. Dr. Harding nods slowly. Will you teach me? Teach you what? How to stay calm when everything's falling apart. Claire almost smiles. That's not something you teach. That's something you survive. She walks past him. Dr. Glass is waiting near the nurse's station. She steps forward. Claire, Dr. Glass, we're starting a tactical medicine training program for ER staff. She hands Claire a folder. We want you to lead it. Claire opens the folder. Inside, a curriculum proposal. Emergency procedures, high-pressure scenarios, trauma management. I'm not a teacher. You're exactly what we need. Claire looks up. Why me? Because you've done things no one else here has even imagined, and you survived. Dr. Glass steps closer. This hospital needs someone who understands what it means to work when everything goes wrong, when the power's out, when supplies run low, when you're the last person standing. Claire's hands tighten on the folder. I didn't come back for this. I know. But maybe this is why you came back anyway. Claire looks down at the folder again, at the curriculum, at the chance to teach others what she learned in blood and dust. I'll think about it. Dr. Glass smiles. That's all I ask. Over the next few days, Claire moves through the hospital differently. People know her name now. They nod when she passes. Residents ask her questions. Nurses stop to talk. She's not invisible anymore. And it's uncomfortable. Lucas finds her in the supply hallway one evening. You're famous now. Claire rolls her eyes. I'm not famous. 15 million views says otherwise. She doesn't respond. Lucas leans against the wall. You gonna stay? I don't know. Out yet. What's stopping you? Claire looks at him. I'm not sure I belong here. You belong everywhere you choose to show up. She almost smiles. That's a nice way of putting it. It's true. Lucas pushes off the wall. For what it's worth, I'm glad you're back. I never left. Yeah, you did, but you came back. He walks away. Claire stands in the hallway, holding a box of gauze, thinking. 2 weeks later, Claire stands in front of a conference room. 20 residents and nurses sit before her. A presentation slide reads, Tactical Medicine for Civilian Providers. Instructor, Dr. Claire Reeves. She's in scrubs again, but this time, her name is on the badge. You're going to see things you're not prepared for. She clicks to the next slide. And when you do, you'll have 2 choices. Freeze or move. She looks at them. I'm here to teach you how to move. Over the next hour, she walks them through needle decompression, hemorrhage control, and airway management under pressure. She demonstrates on mannequins, corrects hand positions, explains the why behind every step. At the end, a young resident raises her hand. How do you stay calm? Claire pauses. You don't. You just act anyway. But you seem so calm. That's because I've already made every mistake you're afraid of making. She steps forward. The fear doesn't go away. You just learn to work through it. The resident nods slowly. After the session, Dr. Glass pulls Claire aside. That was incredible. It was just basics. No, it was real. Claire looks at her. I'm still figuring this out. So are we, but we're doing it together now. Claire nods. For the first time in years, she feels like she's exactly where she's supposed to be. 6 months later, the conference room is full. 20 residents, 15 nurses, a few attending physicians in the back. All of them watching Claire at the front of the room. She's in scrubs. Her name badge reads, Dr. Claire Reeves, Tactical Medicine Instructor. On the screen behind her, a diagram of a tension pneumothorax. Second intercostal space, mid-clavicular line. You feel for the rib, then go just above it to avoid the neurovascular bundle. She demonstrates on a mannequin, her hands precise. Insert perpendicular, 90 degrees. You'll feel a pop when you hit the pleural space, then you'll hear the air release. A young resident in the front row raises his hand. What if you can't find the landmark? Then you use ultrasound. But in a mass casualty scenario, you might not have that option. So you practice until you can do it blind. She steps back. All right, pair up. You've got 15 minutes. The room breaks into motion. Residents moving to practice stations. Nurses guiding them through the steps. Claire moves between the groups, watching, correcting hand positions, answering questions. A young nurse struggles with the angle of insertion. I can't tell if I'm in the right spot. Claire places her hand over the nurse's. Feel that? That's the rib. Now move up slightly. There. That's your entry point. The nurse nods, focused. Don't rush it. Slow and controlled. Leld is faster than panicked and wrong. The nurse tries again. This time, she gets it right. Good. Again. By the end of the session, every person in the room has successfully performed the procedure. Claire stands at the front, arms crossed, watching them pack up. Dr. Glass enters from the back. That was impressive. They're learning. Because you're teaching them. Claire glances at her. They would have learned eventually, not like this. Dr. Glass steps closer. You've changed this place, Claire. The way we think, the way we prepare. Claire's expression is unreadable. I'm just doing what I know. You're doing more than that. A pause. The board approved funding for a permanent tactical medicine division. We want you to lead it. Claire looks at her. Permanent? Full-time position, salary, benefits, your own team. Claire exhales slowly. I didn't come here for that. I know. But it's yours if you want it. Claire looks back at the empty conference room, at the mannequins, the practice stations, the residents who are learning to save lives under impossible conditions. Let me think about it. Dr. Glass nods. Take your time. That evening, Claire sits alone in her small office. A desk, a chair, a single photo on the wall. Her old unit. 12 faces, all of them gone. She stares at the photo for a long moment. Then she opens her notebook, the one she's carried for 5 years. The list of names: SGT, Rios, CPL, Davies, PFC Gwen, LT Kara Sullivan. 12 names total. At the bottom, she's added 2 more entries. Kabul, 18 saved. Detroit, 28 saved. She stares at the numbers, 46 people who wouldn't be alive without her. But the 12 names above them still weigh heavier. You can't save everyone, but you keep trying anyway. She closes the notebook, sets it on the desk. Then she stands and walks to the window. The city stretches out below. Lights flickering on as night falls. Somewhere out there, people are dying. Accidents, emergencies, disasters. And somewhere, someone is trying to save them. She thinks about the residents she just trained, about the nurses learning to stay calm under pressure, about the lives they'll save because she taught them how. Maybe that's enough. Maybe that's how you honor the ones you couldn't save, by making sure others can. She turns away from the window and picks up her phone, dials Dr. Glass. I'll take the position. A pause. On one condition. Name it. I want to expand the program. Train paramedics, firefighters, anyone who might be first on scene. Dr. Glass's voice is warm. Done. Claire hangs up. For the first time in 5 years, she feels like she's moving forward instead of just surviving. 2 weeks later, Claire stands on the hospital rooftop. The same place the Black Hawk landed 6 months ago. The same place everything changed. Lucas joins her, leaning against the railing. You ever think about going back? Every day. But you stay. Because here I can still make a difference. Lucas looks at her. You made a difference there too. I know, but I lost too much doing it. She turns. Earns to face him. Here, I get to teach people how to save lives without losing their own. That's a good reason. It's the only reason. They stand in silence for a moment, looking out over the city. You know they're calling you Dr. Phoenix now, right? Lucas says. Claire almost smiles. I heard. You okay with that? Phoenix was who I was. She pauses. But Claire is who I choose to be. Lucas nods. I think that's the right call. Claire looks at him. Why? Because Phoenix was a soldier. Claire is a teacher. He pushes off the railing. And teachers change the world. He walks away, leaving Claire alone on the rooftop. She stands there for a long time, watching the sun set over the city, thinking about the past, the people she lost, the people she saved, and the people she'll teach to save others. You can't bring them back, but you can honor them by making sure their deaths meant something, by making sure you keep fighting, by making sure you keep saving lives. She pulls out her notebook one last time, opens it to the list of names, and beneath the 12, she writes one more line. Here. Every day. For them. She closes the notebook, puts it back in her pocket, and walks back inside. 3 months later, the tactical medicine program has expanded to 4 hospitals across the state. Claire travels between them, teaching, training, building teams. She's no longer invisible. She's no longer hiding. She's Dr. Claire Reeves, Dr. Phoenix, the woman who survived the impossible and came back to teach others how to do the same. And every day, she shows up. Not because she's a hero, but because she refuses to let anyone else die alone. In a quiet moment between sessions, a young paramedic approaches her. Dr. Reeves? Yes. I just wanted to say thank you. Your training saved a life last week. Motorcycle accident, tension pneumothorax. I did the needle decompression just like you taught me. Claire's expression softens. How's the patient? Walked out of the hospital yesterday. Claire nods slowly. Good work. The paramedic smiles and walks away. Claire stands alone in the hallway. One more life. One more person who gets to go home. That's why you do this. That's why you keep showing up. She takes a breath and gets back to work. Because some warriors don't need a battlefield. They need a purpose. And Claire Reeves finally found hers. Not in the dust and blood of a war zone. In the sterile halls of a hospital. Teaching others to fight the only battle that truly matters. The fight to save lives. One person at a time. Every single day. Without fail. Without hesitation. Without giving up. Ever. That's what Phoenix means now. Not rising from the ashes of war, but rising every single morning to face the day. To teach. To save. To honor the fallen by making sure their sacrifice wasn't in vain. And as Claire walks down the hospital corridor, past residents practicing procedures, past nurses reviewing protocols, past patients who will live because someone was trained to save them, she realizes something. She's not running anymore. She's home.